We've been talking to the Norman City Council now for a number of months in the city of Norman, particularly around access to mental health care. One of the things that we've talked about is crisis response. The department's in the middle of rolling out a comprehensive crisis response system statewide. Actually, we started November 1st with the first step of that, which is third-party transport. And that's transport outside of a 30-mile radius using unmarked cars and a private contractor as opposed to law enforcement. To us, that's a really important step in reducing stigma and helping to treat behavioral health issues as the diseases that they are, and not as some sort of personal flaw and not as a criminalized act. So that has started. We're also moving forward with statewide mobile crisis. We're currently in an RFP process with that. We're also moving forward with a statewide call center, which will be one number to call from anywhere in the state to access crisis services for behavioral health issues. So I think it's important for people to be very aware of what behavioral health is. Many of us don't know, and unfortunately many of us don't know until we experience it or a loved one experiences. It's good to go out and find the information, find correct information about what this is. There are a number of websites you can visit. The department's website at odmhsas.org. We have a lot of information on that site. There's another site in Oklahoma that we are also involved with. It's called okimready.org. OK I'm Ready has information specific to substance use issues. Also, there's the SAMHSA website, Substance Abuse Mental Health Services Administration. It's samhsa.gov, which is a federal organization that is over behavioral health nationwide. Great information there, National Institutes of Health, CDC, it goes on and on, where you can find this information. But it's important to understand exactly what these are. These are diseases. It's a disease of the brain. Mental health issues, substance use issues, they are diseases that can be diagnosed, they are diseases that can be treated, and our treatment is extremely effective. So Norman has an array of behavioral health services here through private providers, contracted providers that are part of the statewide system. Many different ways to find that help and find those services, but I don't know that everybody always knows that. What I usually tell people, first and foremost, when you need to access services, here's a couple of resources. Number one, talk to your primary care physician. If you have a primary care physician, make sure you bring these issues up, help get referrals as necessary, and get linked to the right type of resources. If you have insurance, you can check on your insurance. There's behavioral health providers. You can talk to clergy if you want and help find access that way. But we also have a tremendous resource here in the city, which is Central Oklahoma Community Mental Health Center. That's on Alameda Street. Look, you can walk in the door during business hours and get help. You can also call them if you need to, set up an appointment, but they answer their phones 24/7. So even if it's past business hours, you're able to talk to somebody, help get that link into services and get where you need to be if you need an appointment scheduled the next day. And in some cases, we're actually able to go out and help the individual at that time. But you are going to find a caring professional who's ready to help. Certainly you can present, if you're in a crisis system, in a crisis situation yourself, to an emergency room. We also have a crisis intervention center here in Norman, operated by Red Rock, which is on the Griffin Memorial Hospital campus. You can walk in the door there and get an assessment, get linked to the services that you need. But really the important thing is to reach out, to ask for those services. And for whatever reason, like I said, it's difficult for some people to know how to access those services. What we want to do is kind of normalize that conversation, make it easier to access and to find help when you need it, and to find the right services, because that's really important. You need to find the right services to treat the disease so that you can be well. And everybody, absolutely, you can be well.